Good morning, and welcome to our inaugural broadcast on WZYX Radio. Hi, my name is Bob Feiklowitz, and I will be your host on this edition of what we like to call Common Sense Matters. Our goal is to bring you news and commentary about anything that will provide you the local view of what impacts us most in our listening area. We'll try to bring you interviews with local people, as well as more regional folks, to help inform and educate us. And most of all, we want to help illustrate what makes us all the same, more than different. This morning, my guest is Rosemary Drake, running to be our representative in the 39th Tennessee Congressional District. Good morning, Rosemary, and welcome to our broadcast.
Thanks, Bob. Let me correct that a little bit. I'm running for the Tennessee House of Representatives, not Congress. District 39 includes all of Franklin County and all of Marion County.
Okay, I stand corrected. My apologies. As we all know, all too well at times, the upcoming election on November 5th is a major news media event. Almost all day and every day, that's all we hear about. Yet here in our area, we have concerns and issues that don't reflect a national debate or concern. It's not about us unless we make it so. So let's try to highlight some things that impact us personally, like school vouchers, grocery taxes, Medicaid expansion, environmental issues, the state legislature, Republican supermajority, and anything else we can think of. Okay, Rosemary, why not start out this morning with your thoughts on school vouchers since the school year just started and why it's important to us?
Okay, let me start a little bit before that with a little bit of introduction about who I am. I am a native Tennessean. I live on Suwannee Mountain near the jump-off area. I am a graduate of Suwannee, the University of the South, and Vanderbilt Law School. Practiced law for over 30 years. I'm retired now, and I'm a beekeeper. And I've taken time off from my farming activities to run for the House of Representatives. In my early law career, I worked as a lobbyist for the League of Women Voters of Tennessee and other bipartisan groups, and I have seen the legislature at a more functional level than it is now, and that's part of why I'm running for office. School vouchers are becoming a hot-button issue throughout the nation. There are some dark money groups that are trying to get states to adopt voucher programs. They're affiliated with for-profit companies that cater to private schools, and that's driving part of the movement towards discussion of vouchers. School vouchers were proposals have been in the General Assembly, the legislature, for over the last few years. There's a pilot program that made a small number of vouchers available in major cities in Tennessee. Those voucher programs have not been in effect long enough for there to be a whole lot of data, but we do know that the TCAP testing scores for those participating have turned out to be lower than those in public schools. So there's not evidence that it's a good solution at this point. The reason there are several reasons I oppose vouchers, but the main reason is that Tennessee is already lagging behind in how we fund schooling, public schools. We are 45th in student funding, and we are 44th in teacher pay. So I don't think it's a good idea to divert public money to private institutions. I have no quarrel at all with private schools. We have some very good private schools in our district. But I think that those schools should continue to be funded by the organizations that started them, which is usually churches. And if folks have the money or can get scholarships to go to those schools, then I certainly support that. But I don't think public funding of those schools as a good solution to the need to improve our public schools. If anything, we need more funding for our public schools, not money diverted to private schools. If you take a look at Franklin County, to my knowledge, we have only 3 private schools in existence. The Winchester Christian Academy, which is a Christian-based school, which has 205 students. Now, this is information off the internet. It may not be precisely correct, but give you a ballpark idea. There's a Catholic school, School of the Good Shepherd, with 59 students. And then we have St. Andrew's Sewanee on the mountain with 236 students. By comparison, the Franklin County public school system has 5,000 students. So if we had a voucher program, these existing private schools have no capacity anywhere near what would be required to provide a meaningful option for people sending their students to public schools now. And I would presume that those who are already being educated in those schools would be allowed to stay. So the benefit of vouchers would go to those already sending their children to those schools. With respect to St. Andrew's Sewanee, the tuition is at the level of around $25,000 a year. So with that a $7,000 voucher, that's for day students. It's more expensive for boarding students.
Those are pretty amazing numbers.
Yeah, a $7,000 state voucher is not going to cover that. So what we find from other states that have adopted voucher programs is that the major beneficiaries of those programs are people who already have the means to send their children to private schools. And one of the effects that has occurred in some places is since those parents are now receiving vouchers to subsidize their tuition, the tuition rates are going up. So
can't beat the system.
So, at any rate, and the other problem with private school education is that we have a significant number of children who have disabilities, and under federal and state law, we have to provide an education appropriate for those students, taking into the account whatever their particular needs are. In Franklin County, there's a 12% of children are disabled in some way or another. Private schools don't necessarily have the program set up to assist those students, and they don't have to. If the public school system has to provide that kind of benefit.
Special needs education.
Right.
So
right.
It's I guess that's an interesting thing, that the private schools don't have any obligation to provide special needs, whereas the public schools do have that obligation.
Absolutely.
And any money that is being sent via vouchers to the private schools is money that is not available to the folks in the public education domain. So it's taking money away from the average public school student, special needs or otherwise.
Yes, and under the state funding mechanism for schools, part of the funding comes from state revenues, and some of it comes from local revenues, and a little bit of it comes from federal dollars. And the formula that's used to determine funding for a particular school system is based on the number of students. So if you remove a certain number of students, give them $7,000 so that they can attend private schools. That
money
reduces
available to the rest.
Yes.
Yeah. That's a nasty problem they have to try to deal with. I mean, you can understand where folks want to maybe send their kids to a private school for whatever reason, but when it comes at the expense of the public schools, it somehow doesn't seem fair that the tax dollars are being redirected that way. But I don't know that there's an easy, I don't know if we want to stop it or not.
Well, there's also a First Amendment issue with funding of private schools. Our First Amendment guarantees religious liberty, but it also guarantees that the government will not be involved in establishing a particular religion. And many of the private institutions, in fact, all of them that I'm aware of in Franklin County, are all church-based, Christian-based, with one flavor or another of Christianity involved in the mission of those schools. So if we start sending state money or public tax dollars to those schools, we're in the business as citizens of establishing religion, which I think is a First Amendment problem. And those who know their American history know that that was one of the major reasons behind the creation of our country in the beginning was religious freedom and also not having a state religion or religions.
Yeah, it's. I think that's one of those divisive type situations that we're heading for right now. On a national level, maybe that's probably where it's more noticeable in terms of the extreme right, trying to dictate religious beliefs and some of those things. So that's going to be an interesting thing to see how things come out in the election on the, November 9th. But let's talk more about what's important to us locally. One of the other things that we've been kicking around are the food taxes. And that's a sort of a gnarly issue. We're one of, I think it is 13 states that have a food tax, and that is something that hits everyone's pocketbook that's in the state of Tennessee. Regardless of what your income is, it still costs you more on a weekly basis to get food. So, what do you think our chances are of doing something about that?
Well, I can't predict what the chances are. A lot of it depends on who's elected to the General Assembly. If things remain as they are, there's probably not much chance that we would remove the sales tax on food. But we are in a period of time where people are really having a hard time with their budgets. Inflation is going down, but we're still up from as a result of the pandemic and the effects of the war in Ukraine. Ukraine was one major food supply country, which has become almost impossible since the war broke out there. But inflation is getting better. But still, there's a lot of difficulty for folks to meet those food budgets. And as you mentioned, there's only 13 states that do tax food in the same way that they tax other purchases. If we took the sales tax off of food, it would be a major benefit to middle class folks and the working poor. And just this last year, the General Assembly gave a huge tax rebate. In Tennessee, we have corporate taxes that are called excise and franchise tax, and there are many huge corporations doing business in Tennessee who were given huge rebates of those taxes or don't pay those taxes, even though they're benefiting from doing business in Tennessee. So I think we could make up the difference by re-examining how we're assessing franchise and excise taxes, our version of corporate taxes, and make that more equitable and capture money from those corporations that are based out of state but are receiving huge benefit from doing business in Tennessee.
Yeah, I think that's something that is happening nationally. Any major, not any, but a large number of major corporations that are paying absolutely zero tax. So they are in fact benefiting from doing business here in Tennessee or anywhere in the U.S., and if they're not paying their fair of the taxes, those dollars have to come some other means, and one of them being the grocery tax. So that's I would love to see that changed, but like you said, I don't know how doable that is at this moment. Something else. Let's just switch horses here for a little bit. Since taxes are something that we pay both locally as well as nationally in the form of our income tax, we have a situation where Tennessee is one of, I think it's 10 states that have not opted to allow Medicaid expansion. And that seems to me something that would be a great benefit to a lot of people here in Tennessee. I'm not sure what's driving the vote against it. It seems to me that it would be a sort of a natural benefit to, I read upwards of like 300,000 Tennesseans would benefit from adopting the Medicaid expansion. So could you shed some light on that, Rosemary?
Yes, we're actually now only one of 9 states that have not expanded Medicaid. I think part of the problem is it's a little bit confusing to people. They don't know exactly what Medicaid expansion means unless it's affected them directly. But we have Medicaid program, which is largely federally funded, that provides health care for those who have disabilities or have been diagnosed with a terminal illness and have limited means, limited assets, and limited income. And we have private insurance that's provided by employers, and we have the Affordable Care Act, which is also known as Obamacare, which provides a subsidy to purchase health insurance, and it also sets some boundaries around private insurance as well, that such as requiring that people with pre-existing conditions be covered. When the ACA, the Obamacare, was initially passed, it was intended to expand Medicaid, and then whoever didn't fall within the new expanded coverage of Medicaid would be eligible for the subsidies under the Affordable Care Act, which the subsidies are based on your income and gradually get smaller and smaller the higher your income is. But there was a Supreme Court decision that limited the scope of the changes that were initially planned as part of the Affordable Care Act. And now we have a gap between those who are covered by Medicaid and those who are covered by the Affordable Care Act. So to be eligible for a subsidy under the Affordable Care Act, you have to have a certain minimum income. I think it's in the range of $14,000 to $15,000 for a single person. Now it changes each year. If you fall under that income, you could still buy insurance under the exchange, but you don't get any subsidy at all. So that there's a whole chunk of people who don't qualify, or not poor enough, their circumstances are not dire enough for them to qualify under Medicaid, but they don't make enough money, strangely, to qualify for a subsidy under Obamacare, the Affordable Care Act. So if you make, say for example, $11,000 a year, you have to pay the full price of health insurance, which is impossible. Whereas if you were made a few thousand more dollars a year, you would qualify for a subsidy that would pretty much almost pay entirely for your health insurance. So we have this gap between those two programs. So the solution, which all but 9 states have adopted, is to expand the pool of eligibility for Medicaid. The effect of this is that people on Medicaid in the expanded pool can get preventative health care, just like you have for any other kind of health insurance. Right now we have people who don't see a doctor until their circumstances are dire. And sometimes that's too late. So people are dying because we're not providing this insurance. And they're also entering the system at a time when their health care needs are much more expensive than they would have been if they had preventative health care each year and identified problems earlier. Now, we have rules that require hospitals to provide emergency care and to provide care when the situation has become so dire that the person absolutely has to have it. Then we have federal dollars and state dollars that help to subsidize hospitals or other healthcare providers that provide care under those circumstances. So we're spending the money, we're just spending it at a point that's further along in the process where it's more expensive for us to deal with that person's illness.
Unless I'm, I guess, misunderstanding, which seems to be popular due to all the various aspects of the Medicaid expansion, the money that would be subsidized is already tax dollars that we've paid.
Primarily federal tax
dollars.
Yes.
So we're looking the other direction at a sizable amount of money that could be used here locally to help keep hospitals open and maybe medical staffs improved and who knows what else. But
right.
By virtue of the current voting in the legislature, that money's just, I don't even know whatever happens to that money. It goes somewhere else, I would presume.
It goes to all the other states who are accepting Medicaid expansion.
I'm sorry, that just doesn't seem to make.
And Medicaid expansion not only helps related to the particular people who are involved, but it helps the rest of the people who are needing health care. Because if a hospital has a significant burden for indigent care, then they end up closing if they can't bill appropriately for the services that they're providing. That means that nobody in that area has the services that hospital would be providing. It's also expansion would benefit people who rely on finding providers that are in their network. If your employer has a network that you have to seek your care from, or if you're under a ACA policy that uses a network, that network is necessarily smaller if those providers in that area can't also profitably treat
Understood.
Medicaid patients.
I'm very familiar with that situation just because I've recently moved to Tennessee, and so I have to get new physicians and medical facilities, and I have to keep going back to my insurance provider to say, is this person in or out of their benefit network? And frequently they're not, just by virtue of the fact that living here in Tennessee in a small town, there's not a whole wealth of physicians and hospitals available. So it has a significant impact. And if you can't get good medical care, and I think the important part being preventative medical care, it makes things so much better than having to get to a situation where your medical condition is in an emergency room, dire circumstances. So that's not good for anyone. The person that's ailing, or the people in the general area that suffer as a result of not having the medical dollars and stuff available.
Tennessee also has a very high rate of bankruptcy related to medical cost, and that's another piece of the puzzle.
Yeah, if medical is so expensive and you can't afford it, or if you do have a major, medical issue, you want
and you're
to
uninsured, yeah,
trying to pay the bills, which is not a good position to be in. That's just ugly, no matter how you look at it. I think one of the things that I've discovered, and you were talking about how many different places where Tennessee rates in the bottom quadrant of a lot of things, is that Tennessee is number 50 out of 50 states with the lowest voter turnout. And there was somewhere else in the low 40s, or high 40s, I should say, where we're ranked very poorly compared to the rest of the nation. And I don't know if there's an answer to that. How do we get people to vote, take interest, become involved a little bit to try to fix some of these situations? And I guess I appreciate the fact that you're, let's call it, coming out of retirement to, stick your toe in the water and say, let me see if I can do something to help. I think that's very, very noble. I think we need more of that. And as the year goes on, and I think the next year is going to be, I don't know if it's going to be volatile or not, but I think it's going to be very interesting because of so many dynamics that are going on in both the federal as well as local level. And I thank you again for taking the energy that you're expending to make this happen. So, are there any other last-minute thoughts you'd like to add to our conversation?
Well, on that topic, up until this year, statistically, only about 25% of incumbents in Tennessee faced any opposition at the primary or general election level. That has really changed. There are a lot of new candidates in the races this year. I think one reason why there's been poor voter participation is often people have not had a choice. Well, you have a choice now in this district. You have folks all over Tennessee have choices that they haven't had in previous years. And from my perspective, supermajority in a legislative body is not healthy for democracy, that we do better with a strong two-party system.
Absolutely.
Where I have the benefit of having had that experience early on in my career doing lobbying for the Tennessee League of Women Voters, but also served as an intern with the Tennessee legislature, and I served with the Senate Finance, Ways and Means Committee. At that time, there was a Democratic chair, Douglas Henry, because the Democrats had the majority in the legislature. But they made a Republican the vice chair, Leonard Donovan, and those two legislators shared an office suite. And it's a totally different, you have a totally different atmosphere when the two parties are working collaboratively towards solutions. Doesn't mean that that you always get what you want.
But at least you're talking.
But at least you're talking. There are ideas coming from all different perspectives, and I think you come up with a better governing product, if you will, with that sort of back and forth of exchange of ideas in a respectful, open,
Absolutely.
transparent way.
Absolutely, because I like to think of myself as being an intelligent individual, but any number of times in my life, when I thought I was absolutely correct about something, I learned something else that changes my mind completely. So the idea of negotiating and compromising is a key to having a good, strong democracy. So I'd like to see more of that, and the supermajority doesn't allow that. And I don't know what the percentage is. I want to say it's something like 80% of the Tennessee legislature is Republicans.
That's I don't know exactly what the statistic
but
is.
It's a significant amount to anybody that isn't of their mindset has little or no chance of getting anything done. So that's not good for anybody in Tennessee or anybody in the country for that matter. So,
right.
let's see if we can't educate ourselves a little bit in the future and become a little bit stronger, regardless of whatever your, I don't want to say regardless of your political choices, because that's where we ended up with the supermajority, but I guess work towards having a little bit more equity and the equality in the government and governance in general. So I'd like to thank you this morning, Rosemary. I appreciate your input and your thoughts. I just need to let everybody know that we'll be doing our program, Common Sense Matters, a couple of times a month. Generally be on the first and third Monday of the month, and our next show is going to be on the 21st, and we will have Victoria Broderick as our guest, and she's running for the U.S. Senate. So this program is sponsored by the Franklin County Democratic Party, and we love you to join us anytime we're on the air, and by all means, get out there and vote. Have a good day, folks. Okay. We'll have to see how it goes.
Nice job, nice job.